My name is Lauren Axthelm, and my assigned country for this project was Japan. So I wanted to know, does Japan provide its citizens with true access to healthcare? So I asked some questions like, can patients make it to the doctor's office or hospital and be able to pay for services not covered by insurance? Are their medical issues truly being treated? Do the patients have a positive experience at a clinic? And are doctors really listening to their patients' needs? So a little bit of history about Japan's healthcare system. Initially, they had some big problems with sanitation issues. Their sewage system was not in any way sanitary, and it was carrying diseases through the water, which is making more people sick. So once that was figured out, according to Lovett, Scott, and Prather, 70% of Japanese were covered by World War II, and all citizens were covered after the war. Kobayashi reports some initial issues with universal coverage, such as variances in services. So there are two national healthcare plans, and if one covered a specific test at a doctor's office, the other plan might not cover it. And there were also difficulty processing payments between the medical clinics and the insurers, and there was a lack of physicians in some areas. According to Toyabe, the government feared there would be too many doctors, and they asked medical schools to lower their admission rates. However, Toyabe also reports the number of physicians is growing each year. So in Japan, there are millions and millions of people living there, and there are way more people to be seen than there are actually doctors to see them. This could lead to doctors spending too little time with their patients, and this could lead to a misdiagnosis or patients not getting any of their problems solved at all. There is also no middle-level healthcare, which could be a waste of time for doctors seeing cases nurses could take care of, such as like a flu test. But if a nurse is seeing a more serious case that a doctor took care of, that doctor could take care of, then a nurse has just wasted their time. According to Suzuki, Nishida, Suzuki, and Kobayashi, there is a shortage of doctors and emergency medical technicians. The shortage of doctors is due to the government trying to scale back healthcare spending in the past, and the shortage of emergency medical technicians is due to the public not respecting their position, which doesn't really encourage anyone to take on the job. Japan also faces a shortage of doctors, which could lead to longer hours for the doctors to have to work and overcrowded waiting rooms. So for financing, Japan has a universal national health insurance plan, and there are two plans under their system: the national plan, which covers business owners and the unemployed, plus their families, and the employer-sponsored plan covers employees and their families. According to Shoji and Hironari, any amounts paid out of pocket over 63,600 yen each month are reimbursed, and, quote, sickness and maternity allowances, end quote, are provided. This is really good because if somebody's out sick for a couple of weeks or they just had a new baby, they can still get an allowance to help them pay their bills and take care of their family. Unlike here in America, you have to, it's like pulling teeth to get any kind of allowance, even if you're offered one. Most of the time, you're not. Insurance premiums are only 10% of an individual's income, which is good for the poor. They only pay what they can afford. Funding comes from employers, taxes, government spending, and other payments from the insured. Kobayashi reports as of 2006, Japan spent 33 trillion yen on healthcare expenses. As of 2006, there were 8,943 hospitals and 98,609 clinics. So this shows that the focus in Japan is on primary care and the prevention of illness. However, the lack of hospitals is an issue because if somebody calls for an ambulance and the ambulance takes this patient to the hospital, but the hospital might have to deny the entry of the patient because they don't have any beds to accept the patient. So this is a waste of time and resources being gas and the time spent driving all over town. And this could be a life or death situation for the patient, so they're wasting precious time. Less invasive methods of treatment are preferred by doctors, and some doctors still use alternative and natural medicines and treatments to treat people's health issues. According to Suzuki et al., there is a culture of, quote, helping everyone in need whenever asked, end quote. And this could leave doctors overworked and patients unhappy because patients think, oh, I'm sick and it's a doctor's duty to take care of me. Even if they've seen 100 other patients today, they still need to see me before they can leave. And if doctors, deny someone, they might lose business from that person. That person might lose faith in the healthcare system. And they don't want to deny anybody, but sometimes that's the way it is. According to Lovett, Scott, and Prather, citizens are tested for lung, stomach, colon, and rectal cancers, and women are also tested for uterine and breast cancers. However, Suji has reported a decline of use in these services since 2003, and it's one of those You have to even get tested to know if you are preventing cancer or have cancer. And primary care is available in Japan, but there are no general physicians. There are only specialists. And this is beneficial and non-beneficial to have specialists working in primary care. First, they're overqualified for the job, and that leaves them less time for special cases and research. And at this primary clinic, they could be seeing more special cases than primary cases because people know there's a specialist there. I'll just wait and take my case there. And this could blur the lines of whether or not you need to go to a hospital to see a specialist or a primary care office to just see about primary care. But the good part is that specialists working in primary care, they could catch a chronic or life-threatening illness early on in a patient and stop its progression. So family is a huge support system in Japan, and according to Sato and Dahlin, women have generally been expected to take care of the elderly members of the family. However, this may be changing as more women go out into the workforce. Women these days, they're not just going to sit at home and take care of the family like they used to. They're going out into the workforce. They want to be the breadwinners of the family. They can do a job, any job a man can do. And so that's really important, but it's hurting the elderly people in Japan. There are some assisted living homes in nursing programs and adult daycare programs for the elderly that are covered under insurance. Religion is turned to for support during times of sickness and death. Respect of the dead is important because, quote, the body is not mere substance, but it's also something precious that is given life by the parents and the two gods that gave birth to the country, end quote. Japanese have a huge respect for dead people, their souls, religion, and they fully believe, that there's more to a person than just a body walking on earth, that they also have a soul that has a higher purpose. So Japan is a relatively healthy country, but they have a few major health issues, like the growing popularity of Western food chains, which could contribute to rising levels of obesity, heart disease, and hypertension in the future. And the elderly are facing a lack of access to healthcare because more people are growing older and less babies are being born, and more young people are going out to the workforce, so this is really leaving them in quite a predicament. According to Levitt, Scott, and Prather, the top 5 diseases causing death in Japan are stroke, heart disease, lower respiratory infection, trachea, bronchus, and lung cancer, and stomach cancer. In 2011, an earthquake and tsunami caused a, quote, meltdown of nuclear reactors at the Fukushima Daiichi power plant, end quote, releasing unknown levels of radiation into the air up to, quote, 200 kilometers away from the plant, end quote, which was reported by Vogel and Sibbald. It was not clear if and how much radiation contaminated the air, the water, the soil, and the food nearby. So if it was high amounts, or even very small amounts, it could potentially cause major future health problems for those that were exposed to the radiation. As for disparities, doctors tend to overprescribe medication to patients because prescribing more medication means more money in the doctor's pocket. And this could be a waste of resources if the doctor's just handing out pills to hand out pills to make more money. And if a patient takes too much of a medicine, they could become immune to it. And, if they need that medicine later on, it could pose a problem then. And doctors may eventually think their job is pretty easy because they just think, hey, I can just hand out pills and make money, and that's not the way it should be. Another disparity is overscheduling of patients because patients may not have time to explain their issue, which could lead to misdiagnosis or doctors only treating the symptoms instead of the disease itself if they didn't look into what the disease actually might be. So in conclusion, Japan has a good healthcare system, including insurance for all and good quality care. However, there are a few barriers to true access in Japan. Patients are rushed through doctor's appointments, which could lead to misdiagnosis or none of the patient's needs being met. Elderly people are running out of access to healthcare due to younger people going into the workforce and not staying at home to take care of their families and the elderly, and low birth rates. And doctors prescribing medication to make money and not fully investigating problems or listening to patients' needs is also a problem. Here are my references. And thank you for watching.